Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the anal canal. The anal canal is the terminal part of the large intestine extending from the anorectal junction to the anus below and in front of the coccyx. The anal canal has no circulation, tinea coli, and appendices epiploicae like that of the large intestine, although it is a part of the large intestine. Location: the anal canal is located below the pelvic diaphragm in the anal triangle in between the ischorectal fossa. The anal canal is 3.8 cm in length with an involuntary internal anal sphincter surrounded by a voluntary external anal sphincter. So internal anal sphincter is a smooth muscle. External anal sphincter is a skeletal muscle. Internal anal sphincter is innervated by autonomic nervous system. External anal sphincter innervated by somatic nervous system. Okay, this is the anal canal. This is the upper part. This is the middle part or pectin. This is the cutaneous part. Okay. The upper part will look at the anal column, anal sinus, anal valve. Okay, so these are present in the upper part of the anal canal. Middle part is the pectin, a transitional zone. Then this is the pectinate line at the bottom of the anal column, and at the lower part of the pectin we have the white line of Hilton. This is also called intersphincteric groove here. Okay, because the internal sphincter is here and the lower part of the external sphincter is here. So this is the level of the intersphincteric groove. This is the white line of Hilton. This is the ischorectal fossa. This is the part of the pelvic diaphragm. The levator ani here showing. Relationship: anteriorly, the perineal body. Perineal body is a site of attachment of 10 muscles of the perineum. It is present both male and female, so it is anteriorly in both male and female. You'll also get bulb of penis, apex of the prostate, and the membranous urethra in the male, and lower part of the vagina in female. Posteriorly, anococcygeal ligament and tip of the coccyx. Laterally, ischioanal fossa, also called ischiorectal fossa. So these are the relationships. So if you look at the relationship in the female, this is a hemisection of the pelvis, anteriorly lower part of the vagina, the perineal body here. This is the anal canal. Posteriorly, this is the tip of the coccyx, anococcygeal ligament, and certainly a lot of fatty tissue around the anal canal. In the male, we have the again anal canal is here. This is the bulb of the penis, spongy part of the penis. Okay, the corpus spongiosum, lower part here, the initial part, bulb of the penis, and the bulbospongiosus muscle. We have the apex of the prostate gland here, also related to the anterior wall of the anal canal. So we are getting corpus spongiosum, bulbospongiosus, and the apex of the prostate. The interior of the anal canal has three parts. Upper part is 1.5 cm, middle part is 1.5 cm, lower part is 0.8 cm. Again, we have to know that the size of the anal canal vary from person to person, vary according to the age, vary from male to female, and it may be 2 cm to 5 cm. The upper part is derived from the upper part of the anal canal is derived from the hindgut, from the endodermal cloaca. It is lined by the simple columnar epithelium. This is endodermal origin. Upper part has anal column, anal valves, anal cushion in the wall. Anal cushion is formed by the connective tissue and the blood vessel containing the venous plexus and branches of the superior rectal artery. Okay. We'll get anal sinuses just above the anal valve. Pectinate line is located at the base of the anal valve, also called dentate line. Okay. Infrequently, the anal valve has may show epithelial projection called anal papilla. Okay. We may have attachment of the anal membrane at the lower part of the anal valve, and in the anal papilla area we have the opening of the anal glands. The middle part is bluish, is called pectin. This is the transitional zone. It is separated from the lower part by white line of Hilton. Okay. The mucosa in the pectin is less mobile. It is bluish. Pectin means the middle part of the anal canal. Bluish because underlying venous plexus. It is not perfectly venous plexus. It is also gets some feeding from the branches of the superior rectal artery. So in case of hemorrhoid rupture, we'll get the bright red blood. The lower part is cutaneous and is 0.8 centimeter in length. The lower part is lined by stratified squamous keratinized epithelium. The middle part, pectin, is lined by stratified squamous non-keratinized epithelium. Even we may get some patches of stratified cuboidal epithelium. So upper part lined by simple columnar epithelium, middle part stratified squamous non-keratinized epithelium, lower part the stratified squamous keratinized epithelium. There is slow transition from the columnar epithelium, maybe few patches of stratified columnar epithelium, then stratified squamous non-keratinized epithelium in the middle part of the anal canal, lower part certainly stratified squamous keratinized epithelium. Okay, so again this is the anal column, anal valve, you'll get anal sinus. Some gland may open here in some type of papilla formation. We have some attachment of the anal membrane here, and anal membrane at this level. Sometimes you may get it. Okay, this is the lower part, and this is a scheme here. We may get here no sebaceous gland, sweat gland. Here only intestinal gland, crypts, liver, colon, and the goblet cell. Here we'll get the sebaceous gland, and gradually we'll go down, we'll get the sweat gland also, sebaceous gland, plus we'll get the hair follicle. Okay. Again, the upper part of the anal canal, lined by simple columnar epithelium, middle part stratified squamous non-keratinous epithelium with some patches of stratified columnar epithelium. This is the part underneath the white line of Hilton. This is containing the sebaceous gland. As you go down, we'll get the sweat gland, we'll get here, sweat gland, sebaceous gland, and the hair follicle. Upper part of the anal canal contains numerous tubular glands or crypts like other part of the intestine. Anal glands open into small depression of the anal valve, the anal crypts. These glands are branched, are lined by stratified columnar epithelium. Cystic dilation of the gland may be seen, which may extend through the anal sphincter. So anal glands are open into the anal crypts. Okay. Close to the anal sinus, in the anal sinus. The same area we also may get very rarely the anal membrane, the embryonic anal membrane, a few fibers or a few parts of the anal membrane. The middle part of the anal canal lacks sweat and sebaceous gland. Lower part of the anal canal contains sweat gland. We'll get sebaceous gland, sweat gland, and eventually we will get sweat, sebaceous gland, and hair follicle. Blood supply of the anal canal, we are seeing the superior rectal artery, branch of inferior mesenteric artery. We also get superior mesenteric vein, continuation of the inferior mesenteric vein. There is a portal vein in the almost side by side this. This is the middle rectal artery, branch of internal iliac artery. It may be variable, it may be absent, it may be a branch of the vesical artery, superior vesical artery in case of female, but usually it is a branch of the internal iliac artery. This is the inferior rectal artery, branch of the internal pudendal artery. That is a branch of, again, internal iliac artery. So our vein will correspond with that of that. Only superior rectal vein is a portal vein, tributary, okay, because inferior mesenteric vein unite with the splenic vein, okay, and the splenic vein will unite with the superior mesenteric vein to form portal vein, okay. So this is superior rectal artery, this is middle rectal artery, this is inferior rectal artery, and there is arteriovenous anastomosis, okay. This is again the rectal circular muscle. It becomes internal sphincter, anal sphincter. This is the anal gland. It opens just on the anal sinus, may form small papillae, but at the same level we may get some connection of the anal membrane, embryonic anal membrane, rarely, but glands are always present, like this gland, okay. This is the circular muscle layer of rectum, become internal anal sphincter. This is smooth muscle, and longitudinal muscles of the rectum become the tendinous here and branch out. It forms the conjoint longitudinal coat of the anal canal. It is getting contribution a little bit from the puborectalis muscle also, okay. And this is the external anal sphincter. It has three components. Some books don't accept nowadays three components. They say all are same. This is the external anal sphincter here, internal anal sphincter. They have communication between them. Okay. Here we have seen again upper part of the rectum, the pectin. Okay. Here intermediate part. Lower part is the cutaneous part. Okay. Then muscles of the anal canal, internal anal sphincter, smooth muscle, and the continuation of the rectal circular muscle extending to the level of the white line of Hilton. This is a smooth muscle. This is supplied by autonomic nervous system. External anal sphincter, voluntary muscle, stated muscles surround the entire length of the anal canal, has three parts: subcutaneous, superficial, and deep. Some authors don't accept these three divisions. This is voluntary, supplied by the somatic nerve. Rectal muscularis mucosa of the rectum continue to the upper part of the anal canal and fixed to the submucosa. Conjoint longitudinal muscle cord formed by the fusion of puborectalis with the longitudinal muscle layer of the rectum at the anorectal junction lies between the external and internal anal sphincter. Anorectal ring is a muscular ring formed by the fusion of puborectalis, deep external sphincter, and internal sphincter. From the anorectal ring, there will be beginning of the anal canal. It extends up to the ends. Blood supply of the anal canal, we discussed superior rectal artery branch of inferior mesenteric artery, inferior rectal artery branch of internal pudendal artery. We have one median cecal artery, is the lowest branch of the abdominal aorta, close to the bifurcation, usually dorsal branch. Venous drainage, superior rectal vein, tributary of inferior mesenteric vein. This is the part of portal system. Middle rectal vein, tributary of internal iliac vein, part of caval system. Inferior rectal vein, tributary of internal pudendal vein. There is a part of the caval system or systemic circulation. This is portal circulation. There is free anastomosis in the wall of the anal canal. We call it portosystemic or portocaval anastomosis. Okay, this will be very prominent in patients with cirrhosis of liver or any other cause of portal hypertension. Nerve supply and lymphatic drainage of the anal canal. Upper part of the anal canal is innervated by the autonomic nerve. Sympathetic fiber coming from the L1, L2 segment of the spinal cord from the intermediolateral gray horn of the spinal cord, L1, L2. Parasympathetic fibers come from the S2, S3, S4. Both sympathetic and parasympathetic fibers are distributed through the inferior hypogastric plexus. Lymph from the upper part of the anal canal drains into the internal iliac lymph node. Lymph from the lower part of the anal canal drains into the superficial inguinal lymph. Okay, so this is the hemorrhoid. This is dilatation of the venous plexus in the submucosa. Okay, as we mentioned, venous plexus also gets some feeding from the branches of artery. So if there is damage to this hemorrhoid, there will be some bleeding. There will be maybe profuse bleeding, maybe small bleeding. These are bright red bleeding. Okay, and the internal hemorrhoids are located. Even if you look in a lithotomy position, you get primary area of the internal hemorrhoids are the left lateral 3 o'clock position, right anterior 11 o'clock position, right posterior 7 o'clock position. We may have other secondary part, and this area represents the anal cushion. Sometimes anal cushion does not work, then there will be more chance of getting the hemorrhoids, along with portal hypertension, cirrhosis of liver cancer, or some congenital weakness of the connective tissue around the blood vessel. That may also lead to hemorrhoid. It is not always cancer or portal hypertension. It may happen in some family members. Okay, it may be inherited sometimes. Okay, this image has been taken from ResearchGate from Google Image. This is from the Mayo Clinic, also from the Google Image, with gratitude to them. Okay, we got that. Clinical note: hemorrhoid, the varicose dilatation of the vein, the superior and inferior hemorrhoidal plexus. Okay, internal hemorrhoid if it is above the pectinate line, external hemorrhoid if it is below the pectinate line. This is painless. This is painful because it is innervated by the somatic nerve. Anal fissure, again painful condition, tear in the anal canal, especially on the posterior median region, maybe anterior median region. Why? Because the mucosa is tightly adherent to the underlying tissue, and this area has impact of the force by the hard stool, so there may be tear. Okay, so there will be painful longitudinal tear in the wall of the anal canal, especially posterior median, maybe anterior median in anal fissure. Fistula and ano. Fistula means communication between two channels from the anal canal to the outside to the skin, or one canal to the another viscera from the anal canal to the vagina. Okay, here usually in fistula ano it goes to the skin from the anal canal. Okay, it is lined by granulation tissue connecting the anal mucosa to the perianal skin. But fistula definition: connection between one hollow organ to the surface, or the connection between two hollow organs. Imperforate anus: if you are placed in a neonatal unit, you may get a few cases almost every week. Imperforate anus of the newborn. It's a congenital birth defect. Anus is blocked, but the anal canal may open in the perianal skin or at posterior wall of the vagina in female neonates. Development of anal canal. Okay, the upper part is developing from the endodermal cloaca, a part of hindgut lined by the endoderm. The lower part is coming from the ectodermal proctodium. Okay, so lower part is lined by stratified squamous keratinized epithelium. Highlights: terminal part of large intestine is the anal canal. Development from two sources, one from cloaca, upper part, lower part from the proctodium. We know the situation and relation. Internal anal canal, lining epithelium, gland, anal column, anal valve, anal sinus, pectinate line, and anal cushions. Anal cushion around the blood vessels, around the venous plexus. Transition zone of pectin. This part has no sebaceous gland, sweat gland. Then white line of Hilton separates the transition zone to the lower part of the anal canal. From this line, we get the sebaceous gland will get eventually sweat gland, sebaceous gland in the lower part will also get some hair follicles. Sphincter, external anal sphincter, internal sphincter, conjoined longitudinal cord, continuation of the longitudinal muscle cord of the rectum. Internal sphincter, continuation of the circular muscle cord of the rectum. Okay, we have anorectal vein, rectal space or anal space, blood supply, nerve supply, lymphatic drainage. Lymphatic drainage above the pectinate line going to the internal iliac lymph nodes. Below the pectinate line, lymphatics go to the superficial inguinal lymph node. We have hemorrhoid 3, 7, 11 position. We can see the primary hemorrhoid, internal hemorrhoid, that is above the pectinate line, that begins above the pectinate line, and we see bilitudinal position. Okay, imperforate anus is a congenital birth defect. Okay, and that's all about the anatomy of the anal canal. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe. Have a nice, wonderful, and blessed day. Bye now.